he says, just give the information. So, this next chapter I dedicated to narcissistic personality disorder. Try to get my pen not to fly away from me. So, a healthy, even sometimes inflated sense of self can be a good thing. In fact, some researchers believe those who have somewhat grandiose views of themselves are mentally tougher, less stressed, and less at risk for depression. However, narcissism exists on a spectrum. On one side, it's craving the occasional compliment. On its darkest side, it can creep into pathological territory. NPD is one of 10 personality disorders recognized in the 5th edition of the Diagnostic and Statistical Manual of Mental Disorders. So the hallmark signs of NPD read like laundry list of what not to look for in a significant other. An inflated sense of self-importance, a lack of empathy for others, and a deep need for constant attention or admiration. While someone with NPD self-esteem can be off the charts, ironically, it can also be super fragile, dependent on external validation or self-deception. They will believe grandiose fantasies about themselves, i.e. they are smarter, than anyone, more attractive than anyone, or more successful than everyone they know. Easily put other people down, and generally hijack any conversation or situation to make themselves feel better or superior. Feeling less than perfect is very uncomfortable for a narcissist, and they protect themselves from it at all costs. A personality disorder like NPD is about disturbed relationships, really. People with personality disorders as a class have a lifetime of struggles with intimate, interpersonal relationships with their family, their friends, their coworkers, and this is especially true for those with NPD. The disorder affects 5% of the general U.S. population, with a greater prevalence in men than women. But the percentage is low because in order to be diagnosed, someone with NPD has to admit they have issues, which they often don't. The real problem with an NPD is that the individual lacks good insight into what's going on. They think that the problem is all about everyone else, not them. And it can manifest differently in men versus women. According to research, compared to males, a narcissistic female personality is more likely to include deep insecurities, martyrdom, jealousy, and competitiveness. With other women often seeing themselves as a threat. Think about the overbearing mother-in-law. Men, on the other hand, are more likely than women to exploit others and feel entitled to certain privileges. They are also more apt to exhibit qualities of assertiveness or power hunger. However, this is not to say these traits are exclusive to either sex. When it comes to vanity and self-absorption, both sexes rate equally. Narcissism subtypes is important to know. When you think of a narcissist, certain people may come to mind. The guy at the gym, in the too tight of a tank top, who's more concerned with how his muscles look than in the mirror than actually working out. Or the coworker who fills her Instafeed with her face at every angle. But narcissism isn't just about looking pretty. They are, in fact, a few different types of narcissists. There is, number one, the covert narcissist, or a vulnerable narcissist. Basically the exact opposite of the stereotype. Instead of craving the spotlight and constant admiration, covert narcissists tend to be shy, self-effacing, hypersensitive to how others perceive them, and chronically envious. They often think their pain or suffering is worse than everyone else's, and may even believe they are the ugliest person in the room. Number two, the cerebral narcissist. They derive their self-importance from their intellect, believing they are smarter than everyone else. Number three is the somatic narcissist. They get their self-worth from their bodies. They tend to obsess over physical appearance, including weight, and criticize others based on their appearance. Number four is the spiritual narcissist. These are the ones that quote scripture but are evil, because they use religion to intimidate or justify harmful behaviors to others that can creep in when an individual takes a holier-than-thou stance, overemphasizing their level of spirituality or closeness to God. Harmful behaviors can happen when, and as an example, a church leader claims they had a vision from God about someone else, or that they are in a higher position to use biblical passages to control, hurt, or shame someone. Other types mentioned in NPD research include grandiose or overt, that stereotypical over-the-top attention-seeking type, and high-functioning, meaning those who may use traits such as competitiveness and exploitation to succeed in a profession or endeavor. However, it should be noted that this is a broad spectrum. I realize that, it's presentable traits with NPD, each with varying levels of severity, so subtypes should be used as guides rather than hard and fast rules. NPD is a label that gets thrown around a lot, especially when someone seems conceited or acts out of self-interest. But a narcissistic action every now and then isn't the same as having a personality disorder, he tells me. With the latter, a narcissist's self-absorbed and self-centered way of thinking and behaving surfaces in every area of their life, from work and their friendships to their family and love relationships. So the 9 most common traits for NPD include having an inflated sense of self-importance and entitlement. Deep down, you feel like you're the best, most successful, competent, insert praise here, in any situation. Needing constant admiration, your self-esteem is like a balloon without a knot, requiring a steady stream of attention, approval, and recognition to keep it inflated. No matter how much someone tells you that they love or look up to you, it feels like it's never enough. Expecting special treatment, whether it's favors or apologies, whatever you want, you believe you deserve to have it because you're superior to everyone around you. And they know it, and they should comply. Exaggerating achievements and talents. You have no problem embellishing the facts or even outright lying about your life, your resume, and experiences. Reacting negatively to criticism. Even though you crave control and take full credit when things are going well, you are quick to blame others whenever a situation doesn't go as planned. It's extremely hard to accept criticism or admit to mistakes because, naturally, it's always someone else's fault, not yours. Being preoccupied with fantasies about power, success, and beauty. You tend to create and believe exaggerated, unrealistic narratives about your success, relationships, even how good you look to help you feel special and in control. Anything that threatens that fantasy is rationalized away or simply ignored. You also want people to feel envious of you, and you feel pretty envious of people who have what you want. Taking advantage of others. You often don't think twice about using or exploiting other people to achieve your own ends, whether maliciously or obliviously. You care about your relationship and the people in your life on a superficial level. If they elevate your social status or make you look good or feel good, for instance, and you don't really think about how your behavior might affect them. Having an inability, unwillingness to recognize the needs and feelings of others. You're super sensitive to people, how they treat you and react to your needs and feelings. But on the flip side, you can't put yourself in other people's shoes and empathize with their experiences. You might belittle others or even bully to feel better about yourself. You never really go deep in any of your relationships either, and frankly, it doesn't bother you all that much. Behaving in an arrogant manner. With an inflated ego and sense of superiority and entitlement, you probably insist on having the best everything. The best car, the best office, the best design clothes, monopolize conversations, look down on people you perceive as inferior, and only associate with those you think are equally special, successful, and talented. So how is NPD diagnosed? NPD is not the kind of condition that can be diagnosed with a blood test, MRI, or exact scale. And according to the DSM-5, a person needs only 55% of the above traits, symptoms, and behaviors to be considered narcissistic. Nailing down NPD can be a little more complicated, since narcissists tend to think there's nothing wrong with them. They rarely enter treatment. This is in part may explain why we might feel we know and encounter many narcissists, but only an estimated 5% of people are actually diagnosed with NPD. This is also why you can't ask your therapist to diagnose your narcissistic husband with a disorder if he doesn't think he has a problem. Narcissism hinges on personality traits alone, most of which are objectively negative. It's pretty easy to label someone with these tendencies as well as a jerk. But psychologists want to be extremely careful about pathologizing someone's personality. We can't be diagnosing people. A clinician NPD diagnosis is given to someone who is experiencing social and occupational impairment and subject to stress, which is a fancy way of saying that their narcissistic behavior is not only messing with their work and personal lives, but they're actually aware that it's destructive and it's making them uncomfortable. In other words, if a self-entitled, grandiose, empathy-lacking person doesn't see a problem with the way they live their life, they're simply just a narcissist, full stop. A clinician usually won't diagnose an NPD until they are struggling with their behavior and seek help to change it. This individual most frequently comes to therapy to either A, get support for their perspective, or B, because a family member is insisting and it's easier to comply. Sometimes it takes facing a serious ultimatum, failure, or loss for someone with this personality type to get help. And it's not uncommon for them to seek treatment for another mental health problem altogether, like depression. Some may ask, what causes NPD? There's no simple cause of NPD. Most researchers agree that both genetic and environmental causes are at play. Individuals with NPD have been found to have less volume of gray matter in the left anterior insula, the part of the brain related to empathy, emotional regulation, compassion, and cognitive functioning. So when NPD develops, by definition, personality disorders are developed over time and through childhood experiences, genetics, and environment. Noting that as an adult, narcissistic traits on their own are not likely to develop into a personality disorder. Often NPD will begin in the teenage years or early adulthood. Personality disorders are typically diagnosed at 18 years or older. The things to keep in mind with kids is that some narcissistic traits are simply just typical of their age. For instance, teens by definition are self-absorbed, and it doesn't mean they're going to develop into a full-blown disorder. Scientists believe that the full onset of NPD may occur when interpersonal development is compromised. For example, being born with an oversensitive temperament, learning manipulative behavior from parents and peers, being excessively praised for good behavior and excessively criticized for bad behavior, suffering from severe childhood abuse or neglect, inconsistent or unpredictable parental caregiving, growing up with unrealistic expectations from parents, being excessively pampered or overindulged by parents, peers, or family members, being excessively admired with no realistic feedback to ground you with reality, receiving excessive praise from parents or others focused on your looks or abilities. So what are the treatments for NPD? Is probably the next question. For me it was. So for those who do seek help, psychotherapy, also called talk therapy, can help by working to increase empathy and compassion. Also, meeting with a therapist, you'll learn how to better relate to others, which can encourage more functional and improved interpersonal relationships, as well as gain a better understanding of your own emotions and why you feel the way you do. Along the way, your therapist might work with you on accepting and maintaining relationships with coworkers, families, tolerating criticisms and failures, understanding and regulating your feelings, minimizing your desire to attain unrealistic goals and ideal conditions. But don't expect a personality adjustment overnight. Treatment for NPD can be a long, slow-going uphill battle. And just as with other personality disorders, patients may need to be more motivated than a typical therapy client to make progress and resolve their issues. While in treatment, those with this personality type tend to be mistrusting and reluctant, exhibit negative reactions, and often drop out early. Since the work deals primarily with personality traits, which are pretty steady over time, it could take many years of psychotherapy before a breakthrough happens. The good news is studies and intervention with those living with NPD have shown that some are in fact capable of learning and feeling empathy, which is the ultimate antidote. And while there are no psychotropic medications to treat this disorder, specifically keep in mind, okay, that the likelihood of a co-occurring psychiatric disorder along with NPD is a possibility. If you are living with this condition and also dealing with depression or anxiety, addiction problems or substance use disorder, bipolar disorder, an eating disorder, or any other illness, you may be prescribed medications that are helpful in treating those conditions. Living with NPD can be challenging for the individual with this disorder, as well as their family members and the people around them. If you have this disorder, you may frequently experience emotionally dysregulation. Trouble keeping calm, basically, particularly when other people threaten or contradict your thoughts and ideas about yourself. You may have difficulty maintaining personal and professional relationships as a result. People with NPD are typically capable of completing the necessary activities of daily life. Consistent support from a trained therapist can also enhance your productivity and your quality of life if you have NPD. With therapy, you can learn to recognize and own your actions, cultivate healthy relationships, empathize, and communicate effectively with others. This can be a slow process in some instances, but with openness and strong motivation, you are likely to see significant progress. If you are living with someone who has NPD, you may find yourself feeling confused and frustrated most of the time. You will probably have to deal with their changing moods and behaviors, their need to intimidate and exert control, and a sense of entitlement and gaslighting. People with NPD lack empathy and may completely disregard your needs, your concerns, your feelings. Once the love bombing phase is over, your relationship with them can leave you walking on eggshells around them, feeling constantly anxious and always waiting for the other shoe to drop. Living with someone who has NPD can take a serious toll on your mental health and well-being. It can damage your self-esteem. You may quickly begin to feel worthless and question your perception and your sanity. It can be hard to resist the confidence, the assertiveness, and excitement that surrounds a person with NPD. But those same traits that drew you into that person or to that person in the first place may eventually become a turnoff when you start to notice the impact of their unemotional response to relationships, the cruelty of their lack of empathy for others, and the grandiose belief they are greatly important and should be treated as such. Some healthy ways to communicate with someone who has NPD. Conversations with people who have NPD can be tricky. They are usually one-sided, manipulative, and superficial. However, healthy communication is possible in some cases. Usually a calm, respectable tone. Don't use statements beginning with "you never" or "you always." These may be triggering and make them feel defensive. Use I statements to share how you feel and what you want. Know your boundaries and stand up for them. Try gray rocking. Be as uninterested as possible when the person with NPD tries to pick a fight or gaslights you or otherwise trigger an emotional reaction. Lastly, managing emotional distress. It's easy to get overwhelmed if you live with someone with NPD. So regularly carve out some me time to recharge. Self-care can include practicing relaxation techniques like meditation, taking a nature walk, running a warm bath, and eating healthy foods. Engaging in these activities can build resilience and foster self-esteem and confidence, making it easier to cope with someone that has NPD. All right, guys, have a great day. Hope this information helped. Bye.